So when we see children for holistic dental services, what I have noticed is that some parents come in with the notion of wanting just absolutely no metal in their child's mouth, and that they don't necessarily want to do any type of testing to determine which material is more compatible with their children. Their main concern is that they just don't want any metal at all in their child's mouth. And so that's something that, depending on what the child's needs are, can be addressed. Sometimes if there is a tooth that needs to have a crown, there's metal crowns and there's non-metal crowns. Sometimes there are children that have large cavities on teeth, but they're not candidates for the non-metal crowns. And in that case, we have to discuss what the best course of treatment is then. If a crown, a non-metal crown is not an option and a filling is not an option, and something has to be done with the tooth. If a cavity is very large, it's at risk of causing infection or pain on the tooth, then typically an extraction is recommended, but it's all dependent on a case-by-case basis. What the x-ray show, what the child's mouth shows, what the whole case entails, the age of the child, etc. So whenever we get patients that want holistic options, some of them come in and they just absolutely want no metal in the mouth, no matter what. They want to use other non-metal materials. Other times we get parents who want the most biocompatible material for the child's treatment, and for that we're going to have to resort to additional testing to figure out what the child is least reactive to and most reactive to when it comes to the materials that we use. And that does require additional testing that is not done in our office. There's a blood test as an alternative, there is a muscle testing as an alternative, and there's another testing called EAV as an alternative. And so those all can be discussed when the patient is here in the office. For that, again, there's some additional testing that should be done. And so we can certainly direct the parent to what the options are and how to have them done, and then how to proceed with treatment from that.